This is Michelle Smith, the State Coordinator for Action for Healthy Kids. Welcome to Leveraging Data to Improve School Wellness. We are putting these webinars on as part of a group to support the whole child model and coordinated school health efforts in Texas. And it's brought to you by Texas Action for Healthy Kids, Texas Department of Agriculture, Texas Department of State Health Services, and Texas Education Agency. All of us are working together, and we try to provide at least 4 webinars during the school year that relate to coordinated school health. And let's see if I can get there we go. Logistically speaking, you have the ability to use either your telephone or your computer speakers for this. Hopefully the audio sounds good. Everyone who is listening in will be muted. Only the speakers will be open. If you are wanting to submit a question, you will see a question box in the control panel that is on the right side of your screen, or at least it should be. We are recording this webinar, and we will send a link after, probably today or tomorrow, so you will be able to share the recording with others if you feel would be interested in this topic. Also, the slides will be available and sent out after the webinar as well. Please stay on the webinar and answer the brief survey. We really use the information we collect after the survey for future planning, and would like to have your input on the webinar and how useful it is to you. So today we have with us Anita Wheeler, who's the school health coordinator and school nurse consultant with Department of State Health Services, and Jennifer Haussler Garing, who is the state YRBS and school health profiles coordinator. And I'm going to turn this over to them, and they will be doing the presentation.
Thank you, Michelle. This is Anita Wheeler, and as Michelle said, I am the school health coordinator and the school nurse consultant here at the Department of State Health Services. It is my distinct pleasure to introduce our speaker today. Jennifer Haussler Garing is an epidemiologist with the Center for Health Statistics at the Texas Department of State Health Services, where she has worked for the past 11 years. Prior to coming to Texas, she worked at the Virginia Department of Health and also at the Richmond City Department of Public Health. Jennifer has coordinated the collection, analysis, and dissemination of data for the Texas Youth Risk Behavior Survey since 2009. Jennifer is a graduate of Johns Hopkins University and the University of Massachusetts Amherst. She is a native of New Hampshire and now lives in Austin, and we are so thrilled that she's part of our school health team. At this time, I'd like to turn it over to Jennifer.
Good morning. Okay, well, I'm going to just start with a quick overview of what we're going to be seeing today. We're going to talk about existing data. We're specifically going to be talking about the Youth Risk Behavior Survey, or the YRBS. It's one of several surveys that's done here in Texas. There's also the Youth Tobacco Survey and the Texas School Survey, but we'll be talking about the Youth Risk Behavior Survey. We're going to talk about how you can apply it on the school level, and then we're going to show where to find more data and talk about some direction to some resources. Now, what is the YRBS? It's basically a biennial survey of public high school students. We completed an odd number of years. It's a paper and pencil survey that we do in schools. It'll probably be converting to a computer-based survey in about 2021. It's all self-reported data. We don't go in and do any measurements. It's self-reported height and weight for the obesity measurements. Everyone is voluntary and it's randomly selected. Parental consent is required. We do basically either active consent or passive consent based on district requirements. And everyone is anonymous, and the data is weighted to reflect the actual high school population of the area being surveyed. Now, what risks are part of the survey? We basically look at the leading causes of morbidity and mortality in adolescence and adulthood. So that's basically cancer and heart disease for adulthood, and for adolescents, that's accidents, suicide, and violence. So we're looking at behaviors that contribute to injuries and violence. And we also look at sexual behaviors that contribute to unintended pregnancies and things like HIV. Alcohol and other drug use contribute to accidents. Tobacco use contributes to heart disease and cancer. Obviously, unhealthy dietary behaviors and inadequate physical activity, and the prevalence of obesity and asthma. Now, there are 3 levels of YRBS data that are collected. There's the national data, which is a random sampling of schools across the nation, the state data, which we're going to be talking about today, and then there are also large urban school districts across the country that are sampled and through a CDC program. And here in Texas, Fort Worth and Houston are part of that program. Now, this year's Texas YRBS was completed between February and May of 2017. We surveyed a little over 2,000 students, and we are so grateful to the schools, districts, and students that participated in the survey. But what did we find? I'm going to start with obesity and overweight because those have gone up in the past several years. We're looking at close to 19% of students who are currently obese and an additional 18% that are overweight. Now, what is leading to that? Basically, screen time. So we're looking at children spending, almost 22% of children spending more than 3 hours a day in front of television. And this is still the TV in your living room that you're watching. And as far as spending time watching streaming videos and that sort of thing, 42.7% of children are watching electronic devices for more than 3 hours a day on the average school day. Bullying is a big issue. We're especially interested in electronic bullying now in Texas. So I wanted to share these statistics with you. And it's higher among females than males. So we're looking at about 16% of males are bullied on school property. 21.5% of females are bullied on school property. And electronic bullying is lower among males and about the same among females. Now, distracted driving is something new that we've been looking at, texting while driving and also talking on the phone while driving. As you can see, it increases with age. And we're looking at really high rates among seniors in high school. And actually, when you compare the data on how many seniors are always wearing seatbelts and how many seniors are texting while driving, the rates are about the same, which is really kind of disturbing. Now this is, I thought was interesting because this is the percentage of students who are really prepared when they come into the classroom on a basic level, whether or not they've actually eaten breakfast and whether or not they've actually had 8 hours of sleep. And these percentages are rather low when you think about these basic preparations for learning. Only 31.5% of students eat breakfast 7 days a week, and only 25% of students get 8 hours of sleep on the average school day. Now you may be asking yourself, how can I apply this data to my school? I wanted to use a school that we could apply it to, so I created my own school. And I wanted to use a basic school, so I used the enrollment of my own high school and also the high school that my nephew is going to be attending next year, which is about 1,500 students. And we're just going to locate it somewhere in Texas. And we're going to use this school population to estimate the likely number of students experiencing risk factors by applying the state rates to this basic school. We're going to start with suicide because Texas has a higher than average suicide rate for attempted suicides. Now the state rate is 12.3%. So to estimate the number of students that have likely attempted suicide in the past 12 months in our basic Texas school, we'll multiply our population of the school, which is 1,500 students, by the attempted suicide rate, which is 12.3%. So that's 1,500 multiplied by 0.123, and we'll get 184 students. So that's the estimated number of students who have likely attempted suicide in the past 12 months. Now, I'm not suggesting that you'd go out and try and find exactly that number of students. This is a ballpark figure. It's just an estimate to give you an idea of how many students are experiencing that kind of risk factor. And the state rate for binge drinking is 11.8%. So you'd estimate that about 177 students in your basic school have likely binge drank in the past 30 days. And also we'd look at the current marijuana use for the state being 17%, and estimate that 255 students have used marijuana in the past 30 days. Moving on to some less frightening facts. We'll talk about conventional tobacco use. It's 12.6%, which is going down. And we'd estimate by multiplying 1,500 times 0.126, we'd get 189 students that have likely smoked cigarettes, cigars, or used smokeless tobacco in the past 30 days. Now, the state rate for having no physical activity at all in the past 7 days is 19%. So we'd estimate that about 285 students in our basic Texas school have not had at least 60 minutes of physical activity on any day for the past 7 days. And lastly, the state rate for concussions while playing sports or being physically active is 15.6%. Now that was kind of surprising to me because it seemed high, but it's probably not surprising to a lot of you because you keep track of when students have concussions in your schools. But from that, we would estimate that 234 students in our basic school have had a concussion while playing sports or being physically active in the past 12 months. Now, where can you find this great data? There's the DSHS website, which has all of our data from 2001 on. And if you go to the YRBS website, which is listed on this page, on the left side, there's interactive data results, and you can get all of the data. We don't have the 2017 data up quite yet. We just got it back. So that'll be up in the next few weeks. You can also go to CDC Youth Online, which will be updated with the 2017 data in June 2018 when every state has their 2017 data available. And you can compare Texas to Houston and Fort Worth. You can look at Houston and Fort Worth alone, as well as other cities, states, and nation. And they also have the data up that you can look at it by sexual orientation. So that's something else to look at. And then also Friday Beat, which is an excellent resource with lots of great information. We'll be pushing out monthly data briefs from the YRBS on single topics each month starting in 2018. So if you're not signed up for the Friday Beat, you definitely want to sign up for that. And that is all I have. So if you have any questions, please submit them.
Thank you so much, Jennifer. I do have a couple of questions here. If you go back to the slide that showed TV and electronic usage, it had like 20% TV and 40% electronic devices. Are those are they separate, or does that?
They're separate.
Like 60%, they could spend 60% of their time on television and electronic devices?
That would be 21% have spent 3 hours a day or more on the television, and 42.7% have spent 3 hours or more per day on electronic devices.
But would the electronic devices also include television, or is that just?
No,
computers?
the electronic devices are computers, tablets, smartphones.
Gotcha.
For non-school related things.
So they could be watching television and also spending 3 hours.
Correct.
Wow.
Correct. Yes.
Yeah, that sounds like teenagers these days.
Yes.
Were e-cigarettes included in the tobacco usage?
No, e-cigarettes are separate from the conventional tobacco usage. When you add e-cigarettes, it goes up about 4 percentage points.
And how do our rates compare with national averages?
Okay, the national data has not been released yet for 2017, but it depends on the risk factor, how we rate. We have a higher than national rate for suicide attempts, for For obesity, I think we're about the same as the national, but we might be above it now. I'm not sure. We have to wait and see, but it depends on the risk factor.
Okay. How are schools and students selected to participate in this?
Okay, we basically submit a sampling frame of all the schools in Texas, all the public and charter schools in Texas that have grades 9 through 12 in them, and then they are randomly selected with probability proportional to size. So that means larger schools are slightly more likely to be selected, although we still get schools with populations less than 200 in our sample. So we do a random sampling of schools, and then we invite them to participate. And those schools that agree to participate, we do a random sampling of classrooms within their high schools. We basically take a class that's required or a period that all of the students are required to be in classes, and we randomly select classrooms of those.
So how can a School Health Advisory Council use YRBS data to drive change in their districts?
Well, there are many ways that they can use the data. They can use it as a benchmark for what is probably going on in their district from what is going on statewide. They can use it as we were using it to show what is likely happening in their district numerically. And they can use it basically, those are the ways that they can use it.
Can student behavior changes be tracked over time using YRBS?
Yes, they can, and we do track them over time. We've been tracking data since 2001, that although we use different students each time we do a random sampling, we have the data weighted to this high school population, so it is generalizable to the entire high school population. So each year we look at the data and we compare it to the previous years, and we see how it's changed.
So you don't track specific students over?
No, we do not track specific students. That would be expensive, and it would also open us up to having problems keeping students' identities confidential. So we don't want to do that.
Be sure, I've got a couple more questions, so if anybody else has questions, be sure and enter them in the chat box. What does it mean to be weighted?
Okay, to be weighted, it means that we take the rates and we manipulate them to each student's answers don't just correspond to one student. They correspond to multiple, well, a proportional number of students depending on if this student is a certain race or a certain gender, depending on the population. So one student might account for 1.2 students or 0.8 students, depending on what the population is and how many of that proportion of students, that age, that race, that gender that we have in the sample. So they might count for more or less depending on what the overall population is. So when we weight the data, we utilize the overall population of students in the state to correspond with what our sample is to make the data resemble what the state actually is. And also the other part of weighted data is that we have to achieve a certain response rate for the data to be generalizable. And that's the school response rate multiplied by the student response rate. So we have to achieve a certain proportion of schools agreeing to participate and a certain proportion of students that are selected participating.
Okay. How is YRBS related to the CDC school health profile? Is that the data they're using for those profiles?
Okay, the CDC School Health Profiles is another survey that is done it's a survey of school health teachers, and school principals. And that's about policies and procedures in the school and school health courses taught in the school. And they're related in that we can track issues about school health policies and how they affect the actions of kids. So we can look at, anti-bullying policies and how they affect the percentage of kids that get bullied. Or we can look at what proportion of schools have sexual sorry, have sexual education programs, and what proportion of kids are using condoms and protection and that sort of thing, for example.
So if you're a school district and you're wanting to do that type of a comparative analysis, how would you go about that?
You would contact me and request the data sets.
Okay. Awesome.
Yeah.
So they wouldn't have to go to CDC to try to do something like that?
No, they wouldn't have to. If they wanted to use the Texas data sets, they just have to contact me and let me.
Okay. The YRBS is student response to questions, and this person wants
Correct.
to know if students tell the truth on those questionnaires, or how do you know how accurate those are?
Okay. Basically, we know that students tell the truth because we have certain guides that we follow when we're analyzing the data, that if they answer one question saying they've never smoked cigarettes and another question saying that they've smoked 20 cigarettes in the last 30 days, that gets thrown out. So if there's kids that are just drawing Christmas trees, those get thrown out automatically. We also know that there are certain relationships that we see across the board between things like there are higher rates of kids experiencing risk factors before the age of 13 in lower grades. And we see that happening in Texas data and national data in Arizona data and California data. So these are trends, and that's just an example of one of the trends we see, but there are many trends that we see across all the data sets. So we know that that we don't have kids lying because they would have to all be lying on large scales. And we do an awful lot to let the kids know that their answers are confidential. We have administrators come in and give the surveys so that their teachers aren't the ones collecting the surveys. We have them fill out the answers on Scantron forms so that anyone looking over their shoulder or collecting their survey form can't tell what answers they filled out. And we also have them put their answer sheets in an envelope when they turn them in. So we do a lot to protect their privacy. So we don't know for 100% sure that kids are telling the truth, but we have every reason to believe that they're telling the truth.
And what age groups? Is it all high school, or is there?
It's all high school. It's all high school, and we get kids about 15 to 19.
Okay, can I have you switch the screen back to me?
I'm sorry.
No, you're fine. And I think it's really great. This information is I think critical to help schools. I know our School Health Advisory Council, whenever we try to share information or work on an issue, need data to show administrators that there's a problem. So having this available through the Department of State Health Services is huge, and being able to call on y'all to help put together and correlate data with policies and things, that's an incredible opportunity. So I hope those of you who are on this webinar take advantage of this data. There was a time when Texas did not participate in YRBS, and we did not have access to this kind of information. Having it is just an awesome opportunity to be able to support and help you improve the health of your campuses and your district. So thank you both, Jennifer and Anita, for being with us this morning and sharing this information. We'll look forward to those monthly reports. I think that's exciting. If you guys have not signed up for the Friday Beat, Google Friday Beat, Department of State Services, and sign up. It comes out every week. It's a digest format, and you can click on the things you're interested in finding out about. I think it's a fabulous tool. You'll also see information on Action for Healthy Kids events and things coming up on there as well. So we have tried to keep these webinars short so that people do not feel like they have to take a huge amount of time out of their day and get some good information that they can utilize. For upcoming events, you can check actionforhealthykids.org events, webinars. We will have School Health Advisory Council webinars in the new year, as well as Partnering for School Health webinars. And please consider attending this year's annual Action for Healthy Kids Summit. It's February 9th. Marlene Schwartz, who is well-versed in nutrition policy from the Rudd Center, is our keynote. We're also going to have a session on grants, one on health equity in schools, legislation from last session. So we're real excited. We have a new website for Action for Healthy Kids, and it's parentsforhealthykids.org. So you might want to check that out. It's a very user-friendly website for getting parents involved and providing parents with tools and resources to make change happen at the campus or at the district level. So I don't see any additional questions. We're going to draw to a close for today. I hope you all have a wonderful holiday season. Thanksgiving's coming next week. Try to have a few healthy options in there with the pumpkin pie and the pecan pie and the turkey and dressing. And enjoy your families. Be safe if you're traveling. And continue your good work around making sure that our kids are fit, healthy, and ready to learn. And we will see you in the new year.